the symptoms. But let me straight away go to Dr. G.C. Khilnani, Professor Chairman, PSRI, Institute of Pulmonary Critical Care and Sleep Medicine. Thank you so much, sir, for joining me. There are two issues here, sir. One is the issue of science and health, and another is the issue of community health in a country not allowing the leading global minds of medicine to access what is happening, sir. And I open the floor to you.
Yeah, thank you very much. First, I would like to inform everybody that this metapneumovirus is not a new virus. It was first found out in 2001. And if you talk about hospital admission in routine in United States and other countries, 10% of the patients who are admitted with pneumonia actually have metapneumovirus, but it is rarely detected. Like the coronavirus, like COVID virus was a type of coronavirus, and coronavirus has been there for ages. Now let's understand what is this metapneumovirus. This virus generally affects like young children and elderly very seriously. It usually occurs in winters. It is just like any viral illness, like presenting with cough, fever, sore throat, running nose, fever, and self-limiting. By the age of 5 years, 90 to 100% of children are already infected. So it's not something which is rare. But in patients who are very young and those who are elderly, those who are immunocompromised, it can take a lethal turn and patient can have severe pneumonia and in the ICU. If you talk about data, 10% of patients in the hospitalized pneumonia have metapneumovirus, and 4 to 6% of children coming to the outpatient have the same virus. But what is important? Important thing is that like coronavirus was also not uncommon. It is well known and well described in literature. Similarly, this virus is also not something rare. But only thing is that strains keep changing. These RNA viruses are notorious for mutations. As we saw in the coronavirus, the novel COVID-19 came and caused havoc. Unless it is detected and protected, this can spread like wildfire. The mode of transmission is same, like by fomites, that is by touching.
Professor, my question to you is, do mutations over a course of time can create higher virulence? That's one. And secondly, if the minds in medicine are not given the chance to study from where they originate, can it hamper the ability to protect one's population? Like India is on alert now. We know what's happening in China. And if you recall, sir, even when the COVID-19 was being detected and reported, and I was in Dubai and the programs were being cancelled, the China had put a curtain, iron curtain, on information going out. So you have also a geopolitical ramification. They are not like India, open, sharing medicine, sharing vaccine, helping poor countries.
So absolutely, I totally agree with you and understand. And what I want everybody to understand, that why COVID caused greater havoc, because for a very long time China concealed it and people kept traveling before everything was stopped and went into lockdown. And the question that you asked, that these RNA virus, they are notorious for mutation, and every mutant has different characteristics. What happens that the mutant which is more virulent and more transmissible, like we saw delta waves in COVID time, this particular strain was more transmissible and more virulent and more lethal. So similarly, any RNA virus or any virus for that matter can have different kind of virulence and different kind of lethality as well as presentation.
Rapidly rising to falling and falling all the way to zero. This equation has four factors, a little bit of multiplication. So you've got a thing on the left, CO2, that you want to get to zero, and that's going to be based on the number of people, the services each person's using on average, the energy on average for each service, and the CO2 being put out per unit of energy. So let's look at each one of these and see how we can get this down to zero. Probably one of these numbers is going to have to get pretty near to zero. That's back from high school algebra, but let's take a look. First, we've got population. The world today has 6.8 billion people. That's headed up to about 9 billion. Now, if we do a really great job on new vaccines, healthcare, reproductive health services, we could lower that by perhaps 10 or 15%. But there we see an increase of...
I saw a panic in the laboratories where they begin to actually start a movement of another virus. Just like as they said about COVID, this virus will be coming from an animal. It will be over 10 times more dangerous than COVID. Notice here, I'm not validating COVID was there or wasn't. I'm trying to say to you, according to what they shall say, it will be beyond 10 times, 15 times more than COVID. It is a dangerous thing that they begin to discover. When I say discover here, I'm talking about what they would tell us on TV. If you hear the words of a prophet, hear them clearly. This was an animal.
COVID left us. That one was a plandemic, not a pandemic. It was planned. And another one is coming. Yeah, there is another lockdown coming. Mark your bottom dollar. You can bet it. They are already planning it as I'm talking to you. They are sitting in offices to plan what to do now. When they said we are free, I said it. Again, trust me, another one is coming. More dangerous than this one. It will make this one look like child's play. And they'll be more strict on this one.
We also ought to pray against plagues. In that I saw a plague rising. Whether it's a flu strain or whatever it is, but it's a plague that the enemy is trying to bring in. And there are going to be fears of another pandemic. But the Lord said, do not worry. They tried once and they woke you up. Are you not awake now? Let me say this. Don't get angry or something like that. It won't affect you. Not here. But lockdowns are coming. But our Jesus doesn't like lockdowns. They locked him in the grave. He came out. Hallelujah. There is a new disease that is rising. They'll begin to talk about it. They will say it is looking like it is going to be worse than this one. This one that they're going to talk about is not even worse. Few weeks they'll talk about, no, we have realized it's not exactly so. Never fear nothing. Don't fear. There are rumors of war, but there are also rumors of diseases, rumors of viruses. Don't listen to it. We have conquered. You came out. There is a disease that is coming from birds. It is not these ones only flying, even the ones called chicken. Even if they are birds, they are called bird family. And they will try to make it bigger than what it is. They want to put you again in lockdown. That's the plan. Now the problem is with the prayers that went out. They are confused now. They don't know what plan to take, because we uncovered their plans, exposed them for who they are. Before they did anything, they were sitting as Judas. We reduced them by prophetic utterances. We reduced them. They were ready. They had already planned that by March they lock you down. But the disease right now is just rumor out there going out. But they want to make it big in the coming few weeks. They want to talk about it too much. Birds, virus, this thing going around. It has gone on human beings now. By fire, by power, we expose them before time. We expose them before time.
5 years ago, COVID-19 was first reported in China's Wuhan, and years later, the question still remains if the world is ready for another pandemic. The ongoing spread of a novel bird flu strain, specifically the H5N1, is causing alarm among public and animal health officials across the U.S. as it continues to infect various species. The spread of the strain has raised concerns that the virus could mutate into a form transmissible between humans, potentially triggering a pandemic which could bring the world to a halt in a similar way it did years ago, when COVID-19 surfaced and wreaked havoc. National Public Health Agency of the U.S. reportedly found bird flu mutations in a patient in Louisiana. CDC said in a statement that the Louisiana case of bird flu marks the first instance of severe illness that's linked to the virus within the U.S.
A new mystery virus outbreak has sparked concern about another epidemic emerging from China. Beijing's silence, in a way, is not helping the situation. China is reportedly witnessing a rise in respiratory illnesses, including human metapneumovirus, also known as Hmpv.
Powered by the Holy Spirit, Hubert Angel. More up to date than tomorrow's newspaper.
Union Health Ministry has convened a joint monitoring group meeting in view of the rising cases of respiratory illnesses in China. In the past few weeks, the videos of which have also been viral on social media, the ministry has said that as of now, while looking at these videos, they are closely monitoring the situation in China through all the available channels, and the World Health Organization has been requested to share the timely updates regarding the situation. The ministry has added India is well prepared to handle respiratory illnesses and surveillance shows no unusual surge. All right, now in fact this is a big statement that has come at this point of time by the Union Health Ministry. My colleague Mehndi Garg is joining me live on the broadcast. Mehndi, yesterday Union Health Ministry in fact spoke about the Hmpv virus, a COVID-19 like scare in China, also likely to be a big threat for India or not, still remains to be a big question. But ministry has in fact stated that India is well prepared with no sudden surge. Share more details in this regard.
Well, indeed, Simran, the Union Health Ministry has convened a joint monitoring group meeting in view of, rising cases of respiratory illness in China in the past few weeks. And also the neighboring country is witnessing an outbreak of Hmpv virus, which is a human metapneumovirus. And also the ministry said that it is close monitoring the situation in China through all the available channels. And also the WHO has been requested to share timely updates regarding the situation. And also, Simran, India is well prepared to handle respiratory illness, and surveillance shows no unusual surge. These are the statements that have been come from the ministry also. And apart from that, earlier in the day, Dr. Atul Goyal, the Director General of Health Services, has also reassured that the public that there is nothing to be alarmed about the present situation, and urging people to take general precautions. And talking about Hmpv virus, then it was discovered in 2001, but it is a respiratory virus that causes upper and lower respiratory infections, of which cases have been observed in China. After that, India has taken a cognizance over that also, and now the Union Health Ministry has said that they are monitoring the situation in China very closely, and also requested the WHO to provide